Hi, my name is Monica. I'm a nurse practitioner student, and I'm going to be doing your HEENT assessment today.
Okay, thank you.
So I'm going to start by just assessing your scalp, looking at your scalp. I'm going to palpate to feel for any lumps or bumps, looking for symmetry. I don't feel any lumps or bumps. Okay. Now I'm just going to assess your face, looking for some symmetry. It looks good. No contusions, lesions, or lacerations. Okay. I am going to start by palpating for your temporal pulses. Okay, temporal pulses are strong. And now I'm going to just test your cranial nerves. I'm going to have you make a few facial expressions. I'm going to have you just raise your eyebrows. Now close your eyes really tight. Good. You can open your eyes. Give me a big smile. Show me your teeth. Good. Frown. Good. And then now puff out your cheeks. Perfect. Okay. And now I am going to just feel for your TMJ. Just have you open and close your jaw. Good. Close. Open. And close again. Just feeling for clicks and pops. I don't feel any of that. Very good. So the next thing I'm going to do is test your facial sensations. So I'm going to have you close your eyes and you just tell me if you feel any, feel the cotton. You can say now when you feel it.
Yeah, I feel it.
Just say now.
Now. Now. Now.
Great. Okay, now I'm going to move on to your eyes. I'm going to just look at the outer structure of your eyes, make sure the iris are even, looking at your eyelids. I'm going to just pull your eyelids down. Keep your eyes open. I'm going to look to see if there's any redness, checking the conjunctiva sclera. There's no redness, irritation, or drainage. I'm going to have you look up for me. Good. Down. Good. Side to side. Good. And now I'm going to do the accommodation convergence EOM test. So I'm going to have you look at my finger and just follow the finger with your eyes without moving your head, okay? Checking for any nystagmus, checking the eye movements. The eyes are moving at a good pace. Good. And I'm going to just check for convergence. Good. So now I'm going to just check the inner back of your eye, okay? I'm going to dim the lights. Get that to dim. I'm going to use my ophthalmoscope. There we go. So I'm gonna just have you stare straight ahead behind me. Gonna check for consensual reflex of the pupils. And again, perfect. Keep staring straight ahead. You can have a moment if you need. Good. Now checking for the other eye. Very good. Now I'm going to check behind your eye, okay?
Understood.
Okay. So you can just keep looking straight ahead. Just keep looking straight ahead, okay? Checking for the red light reflex, looking for the disc, cup and disc. Then I'm going to move lateral to look for the fovea and macula. Good. You can have a moment. I know, I'm sorry. Okay, I'm going to do the same thing on the other eye. Give you a moment. So keep look just straight ahead. Over my shoulders. Same thing, gonna look for the red light reflex. Good. Gonna keep moving medial. Look for the distant cup. And then I'm gonna move lateral to look for the macula and the fovea. Okay, good. You okay?
Yes, I'm okay, doctor.
Okay, now I'm gonna move on to your ears. I'm gonna look at your ears. I'm gonna palpate outside. Any pain or discomfort?
No, feels pretty good.
Okay, good. I'm gonna do the whisper test.
Okay.
You just repeat after what you hear.
Cat, dog, mouse.
Okay, perfect. I'm gonna do the other side.
Red, blue, white.
Perfect. Okay. Now I'm gonna just look inside your ear to check for any inflammation. Okay, we're gonna pull the pinna back, out. Okay, looks good. Same on this side, pull the peanut out, back. Okay, very good. Now I'm gonna move on to your ears. Nose. Looking at your nose, I don't see any deviation. Looks symmetrical. I'm gonna do the sniff test first. So I'm gonna have you just cover one nostril for me and just sniff in. This is checking for patency, and I'll do the same on the other nose. Good. Now I'm just gonna examine inside your nostril, looking for a turbinate, and normal turbinate, no polyps. Same for the other nose. Good. All right, now we're moving on to your mouth. Gonna just check your lips. Good. I'm gonna check your teeth and gums. Make sure they're healthy. Good. Same on the bottom. Can you open your mouth? Oh, you don't need to stick your tongue out. Okay. Just open your mouth. Checking your buccal mucosa. Making sure there's no inflammation. Good. Gonna check underneath your tongue. Perfect. And then now stick your tongue out and say ah. Okay, good. Thank you. Okay, now I'm gonna just check your neck, your trachea, and your lymph nodes. Looking at your neck, I see your trachea, it's midline, there's no deviation there. Okay, I'm gonna just check and palpate for your lymph nodes. Okay, starting with the preauricular area, moving back to the postauricular area, to the posterior occipital, down to the posterior cervical lymph nodes, all the way down to the supraclavicular area, then back up to the submandibular area, just checking for any masses, then to the submental. You can just keep your head down, please. Then going back to the anterior clavicle lymph nodes. Okay, very good. Okay, lastly, I'm gonna just check your thyroid. I'm gonna just have you take a sip of water and don't swallow it until I tell you to. You just keep it in your mouth. You don't need that big of it. Did you drink it? Okay. So I'm gonna just palpate for your apples. Adam's apple. I'm gonna go lateral. I'm gonna have you just tilt your head forward to the right. I'm gonna push the thyroid and I'll take a swallow. Okay, I did not feel any nodules. Good, I'm gonna do the same again for the other side. Okay, I'm just gonna find my landmark, find the thyroid. I'm gonna have you tilt your head forward, lean to the other side, and did you swallow? You swallowed. Okay, you can swallow. Okay, do not feel any nodules there. Okay, and lastly, I'm just gonna have you resist against my hands. You can shrug up. Okay, very good. That concludes our HEENT assessment. Thank you.
Thank you very much.